So this video is for basic facial, and we start this video as we would every time upon arriving to work. We wash our hands. So we go to the sink, we wet our hands, we find a liquid-sized, we find our liquid hand soap, and we get a coin-size amount, and we wash our hands down to our wrist, and we wash the back of our hands down to our wrist, and we wash our fingers, of course, the backs of our fingers, fingertips and nails. We wash between our fingers and our thumbs. We wash our thumbs, we wash our wrists, and we're going to do all of that wash for a minimum of 20 to 30 seconds, and then we give everything a good rinse under the running water. When we feel like we've gotten a proper rinse, we grab disposable paper towels or a towel, we turn the faucet off, we dry our hands off completely, and then we toss those paper towels into the trash. If it's a towel, it's now dirty and it would go in a closed container until time for laundry. We then grab our hand sanitizer, 70% ethyl alcohol, and we sanitize our hands. Once we get that good, proper hand sanitizer, we are going to be able to prepare our room to get ready for our basic facial, our client that's coming in. So we always want to make sure that we're doing everything we possibly can before our client arrives so that we're timely with her appointment or his appointment. We have a full schedule as well, and we make sure that we're checking those boxes off so that we have almost nothing to do once we do our client consultation. We can get right to the service. So that time that's blocked for our client is really devoted to that client's time and service, and we're not using that time to prep and get ready for the client. So what we're going to do before they arrive is we're going to disinfect our workstation, our bed, and equipment using a disinfectant wipe and following manufacturer's instructions. We are going to check equipment to ensure that all devices are in safe working order and plugged into a working receptacle. We're going to gather clean supplies needed for the facial service and store in a clean, closed container. We're going to turn on the hot cabbie and stock it with at least 3 clean, wet towels. More may be needed depending on the service and the client's needs. We will fill a clean steamer glass with distilled water and we'll preheat our steamer. We're going to dispense products needed for the service according to skin type and client's needs as follows. We'll prepare disposable portion cup tray for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup tray, or remove the product with a disinfected or clean single-use spatula. Close the lid to the product and set the portion cup tray on the tray. We'll drape our facial bed using 1 fitted sheet, 1 flat sheet, and 3 towels. Placing clean laundered sheets down on the disinfected facial bed, placing a towel horizontally at the head of the bed. Lay a hairnet and headband on top of the first towel, along with a roll towel to support the head and neck of the client, and save the third towel to lay across the client's décolleté. So what we're going to go over now is what we have prepared on our tray that is ready for our client that is going to be coming in for the basic facial. And I just need to grab a couple things from the bottom here. Excuse me. So we have our 4 squares, we have our 2x2s, we have cotton rounds, we have wooden sticked Q-tips, we have water makeup remover, astringent, and toner. And our toner happens to be in a spray bottle, just FYI. We have eye cream and moisturizer. We have disposable gloves because we may need to perform extractions. We have cleanser. We have exfoliant. We have a mask. We have a massage product. We have a nice little brush that we can apply our mask with. We have a mirror to present the skin to the client. So we have pretty much everything that we need to perform that basic facial. Our client that's coming today is an existing client, and we do have a plan. This is an appointment that's in a series of appointments for her. We're working on particular goals for her skin. But if that client, if you didn't know the client's skin type, if it was the first time, you can certainly have everything prepared and just not have the products dispensed at the time, so that you can dispense them as you are getting her comfortable in the facial bed, etc. So our tray is ready to go, and we've got it right here, and then we've done all of that prep ahead of time. And so what's left to do now is actually perform the client consultation. So just a quick note, I wash my hands before we prepare the area. Of course, I would be washing my hands again before I went to meet with my client and greet them. But I'm going to wash my hands again before we start the service. So just so you know, I am approaching my client with clean hands. So let's talk about that client consultation. So we're going to greet our client and escort them to the work area. We're going to determine the client's preferences and assess the client's needs. We will assess the client's skin by performing a skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation, for example, lice, scabies, something like that, to prevent from safely performing the service. And all that you can do when you're looking right now is just literally look at the face. This is not your professional skin analysis that you do during the basic facial, but this hopefully will allow you to make some easy observations. We're going to assess the client's consultation form for any medications and products that they might have used within the last 72 hours and consult on any known allergies. So the reason for that is we need to find out if they're taking any medicine that could affect their skin. So maybe the sensitivity level of their skin, or if it's thinning out their skin, whatever the side effects of the medication are that they're currently taking, we need to know. And if we don't know what a medication is, certainly are used for, you can ask the client, and then you can look up whatever you need to know. So let's say people take so much medicine today, they have allergies, so they're taking something that is definitely drying them out, like an antihistamine or something. That will affect their skin, obviously. So those are good things to know to help you perform your service anyway, to do a really good job. But if anything is different or strange, you're going to know that. And then you're going to consult on any known allergies. And the obvious reason for that is you do not want to use a product with an ingredient in it that they could be potentially allergic to. So that's a big red flag right there, and you'll be able to make an adjustment accordingly if you had something out that you wanted to use and that you can't going forward. Maybe someone can't use vitamin C. So there's all kinds of ways to pivot. You just have to know what the specific needs of the client are. You're going to consult with the client on any facial surgeries within the last 3 months, and if the client's under a physician's care, obviously you need to know what's healing, how it's healing, what's healed, what they have done, and why, so that you can support. You need to find out if the client is prone to cold sores or fever blisters. If they're prone to it and they don't have anything active, that's one thing. You can be very cautious. It's another thing if they have anything active, you would never perform any kind of service. It's incredibly contagious, and no opportunity there at all to do a service, so you wouldn't do it. You'll assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. And hydroquinone is like a bleaching agent to the skin. Once again, you would not support doing a facial if they've used that. You need to get past that 72-hour window because it can make the skin incredibly tender and sensitive. Also, if it's been major exfoliation happening already, the skin could be a little bit thinner and way more sensitive to products. So you're gonna wait past that 72-hour window. And then you'll assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. Obviously, that's a contraindication too. You wouldn't do it if they've have had it recently. You need the face to relax and to go to the position that it's going to be in. You don't want to move anything around that you don't need to be moving around. So fortunately for us, our client doesn't have any of those contraindications. There's probably a lot more than this, but the client consultation form time is where you're really going to learn everything about your client that you need to, especially if it's a new client. And you're going to also be able to find out what on their form, what they're telling you their main goal is with their skin, and also what they think their skin type is, why they booked the appointment, what they're going for. And that will help you strategize and move forward on what you're going to do, and then communicate with them what you find out. So thankfully, we have no contraindications. We're not rushing through that client consultation. And actually, once they fill out the initial form, or if it's on a computer, you may adjust them to a more private area so that you can go over some more details on some personal things with them. And then once you know for sure that you can move forward with the service, you can do that. So we're going to get our client Sue into the facial room. So she's going to come in to change. She's got the drape and everything on the facial bed. You're going to close the door and leave, giving her privacy to change and get on the facial bed. You'll come back and check in, knocking on the door, excuse me, and getting that client in for her facial, getting her comfortable on the facial bed, And once you know that she's there and you've been given permission to re-enter, you'll do that. So you've got your lovely client all tucked in. We have an additional towel here that we're going to place across the décolleté for extra support. We've got our rolled towel right here that we're going to place under the neck of the client for additional support. And of course, we have our headband to keep her hair out of her face while we perform the service. Headband, hairnet, whatever you use, that is great. And then while she's getting comfortable, you're going to go to the sink to wash your hands again before you begin the service. So we get to the sink and wet our hands. We find that coin-sized amount of liquid hand soap, and we wash our hands down to our wrist. And we're going to wash the back of our hands down to our wrists. We're going to wash our fingers, and we're actually going to wash the back of our fingers. We're going to wash our fingertips and our nails. We're going to wash between our fingers, and we're going to wash between our fingers and our thumbs. We're going to wash our thumbs. We're going to wash our wrists, and we're going to do all of that interlocking wash for a minute, for 20-30 seconds at least. And then when you've gotten that thorough wash, you feel like, take it to the running water for the rinse. When you've properly rinsed, you're going to grab either disposable paper towels or a towel to turn the faucet off. Dry your hands completely, put the paper towels into the trash. If it's a towel you used, it's now dirty, put it in a closed container until time of laundry. Grab your hand sanitizer, 70% ethyl alcohol, and sanitize those hands. Now you're ready to start the service. So we're going to take her makeup off first. That's the first step. And then we're going to do our first cleanse. Then we're going to remove that first cleanse. And then you are now going to perform your professional skin analysis. And so basically what I'm going to tell my client is at this point in time, I'm going to be getting a very bright light and I'm going to be putting it over her face. So I'm going to cover her eyes to protect them. And we would either be getting a magnifying lamp or a Woods lamp. So I'm going to make sure her eyes are protected before I bring it over and turn the light on. Now I don't have a magnifying lamp or a Woods lamp, so I'm just going to walk through that process with you. I bring the light over and turn it on and it's super bright. And it allows us to look through with the magnification and the bright light for many different reasons. And you would be looking at different parts of the face, looking for different things that can tell you things. Super important, obviously, with your time here that you, number one, is that you are learning your client's skin and you're seeing what it looks like on different parts of the face. So the chin, maybe you're looking for any kind of congestion or excess sebum, cheeks, pore size. Obviously, we're looking for any specific guides that she gave us. Maybe she's really right now, this is a consistent client and we're working on dehydration. She feels like she's starting to see signs of aging. So we're looking for fine lines and wrinkles. We're looking around the eyes for that. We're looking on the forehead. We're looking for hyperpigmentation or redness, maybe some capillary issues. So many things, neck to, this is our time to really see what's going on, what the client thinks they may be dealing with versus what we really see. This is where we're going to make a mental note of everything, because after this appointment is done, we're going to be able to go to either our client card or our software system, whichever we're using, and we are going to be able to document everything about their skin, everything about the treatment we're performed, products that we use, products they went home with, products and services we've recommended. This is where you're going to be able to have the reason or conversation for what you're recommending, how you can really support and elevate their skincare goals and also their skin health, everything that they hope to achieve and you hope to achieve to maximize the best results for their skin. The other thing is that you want to just document their skin and know about it, like their freckles, their moles, anything that they have on their face, so that if something changes and it's something that it's beyond your scope of practice, you're going to be able to recommend or refer them on to a physician that can address it. And that may be something that you would see before they even saw it. So it's really important to take that time here to see what you need to see every appointment that you have with your client. So you've done that professional skin analysis. You can turn the light off, take the lamp away, and at that point you'll be able to remove the light. And I'm always talking to my client and telling them what you're experiencing and seeing, and that just helps them understand the big picture. And now you would do the second cleanse for your client. And that will help remove any dirt, debris, makeup, etc. Anything that you saw that was left, obviously, on the skin. You really want to get in there, and we're going to be doing that second cleanse now. And we can go ahead and remove the second cleanse. And now we're going to go in for the third cleanse. You may not always need to do this for all of your clients, but this particular client we need to do it for. So we are now going to remove that third cleanse. And then we're going to tone. So I've got my toner here and it's a spray bottle. Just going to make sure that the nozzle and the little 2x2s don't come into contact with each other. And then after we exfoliate, after we tone, we're going to exfoliate. So I'm going to get about a pea-sized amount of exfoliant, and I am going to just kind of spread that around a little bit on the client, on the neck and the face. Of course, with all of our steps, we're always going to avoid the eyes, the nose, and the mouth. And then I'm going to massage it in for 1 to 2 minutes. Of course, you're always going to follow your manufacturer's instructions. There's chemical exfoliants, there's physical exfoliants. So you just want to be mindful of what you're doing and what kind you're using, and you always just want to follow those instructions. And once you've massaged in that exfoliant, I'm going to read through what happens next because I don't have the equipment. So you would retrieve the steamer and turn it on. So that's the steamer that you did the distilled water prep, preheat when you were setting up before your client even arrived. And you're going to bring it over next to the facial bed, making sure that it is facing away from the client as the water heats up and emits an even outflow of a mist. Once the steamer is emitting a mist, you're going to position the steamer 16 inches over the client's face, aim it at the client's chin for even distribution on the face, and allow the unit to function for 3 to 5 minutes. Remove the steamer from the client's face, return the steamer to its previous location for disinfection. So we'll bring that facial steamer over here to the side of the bed, making sure that it's facing away from the client. Go ahead and turn it on. And then that little mister is going to start. Once it's sending out that even mist, you will gently turn that steamer towards the chin, and it's going to hold there about 16 inches away so that it can evenly mist over the client for 3 to 5 minutes. Now we're doing a video, we're going to pretend like the 3 to 5 minutes has passed. You're going to turn the steamer away from the client, turn it off, and then return it to where you got it from because you'll disinfect it after the service. Then you can go ahead and remove the exfoliant, and we are going to use a steam towel for that. We do not have a hot cabbie, so I'm going to pretend as if I do. I'm getting my steam towel out of my hot cabbie. I'm going to check that temperature on my wrist, and it is warm but not too hot. It's hot but not too hot. And then I'm going to check it on the collarbone of the client, who says it feels great. So I'm going to gently wrap my towel across my client's face, leaving the nose out so that she can breathe. And I'm going to do a little gentle press. So with our steam towels, they're nice and warm and they start to cool down pretty quickly. So maybe 20 to 30 seconds, you'll start to feel the cool down, and then you'll want to remove the towel and the exfoliant. Just always making sure that you leave the nose out so that they can feel like they're comfortable with their breath. And so all I'm doing now is removing that exfoliant. Don't forget that you put it on the neck as well. And then you're going to want to take a second to make sure that your hands are super dry, because you are going to perform extractions at this point if your client needs it. Now, my client doesn't have a lot of extractions to perform, but we are going to do a couple, and that means that I need to put on my disposable gloves. So make sure your hands are dry before you do that, or it makes this step very difficult. And you can do extractions a couple ways. You could soak 2 cotton rounds in astringent, wrap them around your fingers, and then kind of work your way around the cotton rounds as you perform the extractions and then throw them away. I'm going to use the wooden sticked Q-tips. So we're going to soak those in astringent, and then for every extraction, you just toss it. So one extraction would be 2 wooden stick Q-tips. So I'm soaking in astringent. She's got a little bit here on the chin. Not much, actually. So we get 2 Q-tips for every extraction. We've been working on her skin, so it's looking really, really good. And of course, she's been doing her proper home care, which is super important because they're at home more than they are with you. So we've got one more here to do. And that's it. So once you finish your extractions, you'll remove your gloves and toss them as well. Now you're going to tone. So once again, we're getting our 2x2s and we're getting our toner, and we're going to spray without touching the nozzle to the 2x2s. And with your extraction step, you want to make sure that you don't perform that any more than 5 to 7 minutes, because that can be an uncomfortable thing to have a client deal with, and especially if they have a lot of a need for extractions. And so that can be painful, and you want to move past that as quickly as possible. The good news is after extractions comes massage. So if your client has severe acne, you wouldn't be doing this step anyway, because you wouldn't want to spread bacteria or make anything worse, but our client does not, so we are able to move forward to do a nice massage. And one thing to note here is that you want to go ahead and get as much of your massage product as you might need in order to perform the massage, so you don't have to go back into the massage product. So you're not, back to retrieve any more massage product. So your hands aren't leaving the client for any reason once the massage starts. So I'm just going to spread out some massage product here before I get started. That way the client can really have that relaxed moment, and if the hands are on and off and on and off the face, it's not as comforting. So we're just going to let them relax now in this portion of the facial. And then we would remove our massage product. After you remove your massage product, we're going to apply a mask. We use that lovely brush to apply a mask. And just like all of our other products that we're using, we follow manufacturer's directions. We avoid the eyes, the nose, the mouth. And then, of course, based on the type of mask that you use, and then, of course, your client's skin type, you would then determine how long you're going to leave your mask on. Let's say for this mask, it's anywhere from 5 to 10 minutes. And then for the sake of the video, we're just going to assume that that 5 to 10 minutes has elapsed. So we are going to go ahead and remove the mask. And then we'll do our final tone. Once again, making sure that the nozzle does not come into contact with the 2x2s. And then we will apply her skincare. And the sun's still out, so we are going to do eye cream and then a moisturizer with an SPF. We are going to wait on serum because the sun is going down. She'll go home in a little while and do her nighttime routine, and then so she's going to put her serum on then. I'm going to make sure that I'm applying my eye cream with my ring finger because it's the most gentle finger. So I'm going to lightly tap some on the brow bone and the zygomatic arch. And then I'm going to get that moisturizer, of course, for hydration and SPF because she still has a little bit of daylight out there, and we're going to get her home hydrated and protected. Making sure that she's got this moisturizer on that's a nice physical block versus a chemical. Putting a little bit on the neck, the décolleté, anywhere that it could be exposed to the sun, we're going to do that. And then I'm going to put a little lip balm on as well because we all know that we like a little lip hydration too. Nobody wants any dry lips. And then I'm going to show her how amazing her skin looks, and she's just going to be blown away because it does look so good. We've been really working on it. Let's finish up this facial. And so she's thrilled. So what we're going to do is give her a little privacy now. She's going to take some time to get dressed. And we'll leave and wait for her in the client consultation area. And when she gets out there, we'll be able to go over any maintenance, aftercare. We are going to go review some products that we discussed that would be ideal for her home care regimen that she needs to layer in and add in as she's been getting stuff as she has been coming in for her series of appointments. And then we're going to go ahead and get her booked for her next appointment. We've done all of that, got her checked out, got her on her way, and then we've got to quickly come back into our facial room and get ready for our next client that's coming in. So the first thing that you're going to do when you get in the room is look for any single-use items that you haven't discarded and go ahead and throw those away. Get those implements that are now dirty that you've used and put them in a closed container that's labeled to be disinfected. You'll strip the bed, the facial bed of the sheets, towels, any of the dirty linen, and you're going to put it in a closed container until time to do laundry. Then you're going to look for, identify, and find a proper cleansing agent. You will read and follow the manufacturer's directions for mixing and usage. You're going to do that, and then you'll be able to wipe down your work area station, removing any dirt and debris. Then you're going to identify a disinfectant that is bacterial, bactericidal, virucidal, fungicidal, and EPA approved for use in a salon setting. You're going to need to grab some disposable gloves, get another pair, put them on because you're going to need to use that and have them on as you read and follow manufacturer's directions for mixing and or using aerosol disinfectant. You will also then locate any equipment and disinfect that equipment that you might have used. And that, obviously that electrical equipment, store it in a clean area separate from other implements. And then you have to do your final hand wash. So go to the sink, wet your hands, get that coin-sized amount of liquid hand soap. Wash your hands down to your wrist. You're going to wash the back of your hands down to your wrist as well. Wash your fingers and then wash the back of your fingers. Wash your fingertips and your nails. You're going to wash between your fingers and your thumbs. You're going to wash your thumbs. You're going to wash your wrists. You're going to do all of that interlocking wash for a minimum of 20 to 30 seconds. Then get to that running water, rinse everything thoroughly under the running water. Grab some disposable paper towels, turn off the faucet, dry your hands completely. Those paper towels can go in the trash. If you used a towel instead of paper towels, it's now dirty and it can go in that closed container with the other dirty linen until you get to the laundry. Grab your hand sanitizer, that must be 70% ethyl alcohol, and you will then sanitize your hands just as you did your proper hand wash. And when you finish all of that, you can move forward getting your room ready for your next client that's coming in, which is also a basic facial. So that concludes your basic facial video.